The Affordable Care Act provided two paths to coverage for people with low to moderate incomes. First, people with moderate incomes could receive subsidies to help pay for insurance in the new healthcare marketplace. Second, the law provided that very low-income, uninsured adults between the ages of 19 and 65 would get healthcare coverage through an expanded Medicaid program to be largely paid for by the federal government. The expansion extended coverage to adults below 138% of the federal poverty level, which is about $1,400 per month for a single person and $3,000 per month for a family of four. It also eliminated Medicaid's categorical requirement, which limited adult coverage to pregnant women, parents, and people who were aged, blind, or disabled. Although Medicaid expansion was meant to be national in scale, the Supreme Court ruled in 2012 that the federal government could not force states to expand their Medicaid program, but rather expansion must be a state option. Florida is one of only 14 states that have not expanded Medicaid. As a result, approximately 445,000 Floridians fall into the coverage gap, meaning they have no path to affordable coverage. For example, a working parent with one child who earns just $500 a month is above the income threshold and therefore ineligible for Florida's very limited Medicaid coverage, and at the same time is below the income cutoff for and therefore unable to qualify for a subsidy in order to purchase marketplace coverage. Additionally, approximately 392,000 low-income Floridians who do qualify for marketplace insurance are severely burdened by out-of-pocket costs, complexities in enrollment, and challenges in accessing care, many of which would be resolved with Medicaid expansion. A large body of data and evidence show that those states which have chosen to expand Medicaid under the Affordable Care Act have witnessed improved health care access and individual financial stability, as well as economic benefits for states, local communities, and providers. Many Floridians in the coverage gap who would benefit from expanded Medicaid work in industries that do not provide health care, such as restaurants, hotels, construction, and landscape services. Until Florida expands Medicaid, policymakers and the public must hear from uninsured residents about the suffering and loss that comes with lacking health coverage. The Florida Health Justice Project is working with impacted individuals, advocates, and healthcare providers to help bring these stories to light through our Florida Health Justice Stories initiative.